I was asked to talk about why should we be treating women at the menopause, and it perhaps is rather surprising to have such a question because we are, after all, the International Menopause Society. But it's because in recent years, particularly since the scares from the WHI study, that the prescriptions for hormone therapy, or what we now like to call menopause hormone therapy, has diminished so much, so that only maybe up to 10% at the most of women are being treated, whereas 20 years ago it was of the order of 40%. So we looked at why we should be considering treating women for menopause, and basically it's to improve quality of life, particularly for those experiencing severe menopausal symptoms, but there are also other benefits too. More evidence now coming out about the benefits on cardiovascular disease, and also, of course, for bone. And in particular, we looked at also the benefits for women with premature ovarian insufficiency, because they are at increased risk of heart disease and osteoporosis if they're not treated and given the estrogen that other women would have had up until the normal age of the menopause. And then we also discussed about osteoporosis and the benefits that there can be, particularly for the early postmenopausal woman. A lot of questions came about the types of therapy, and in particular how long people should go on treatment for. And another group that we actually focused on, which was the subject of World Menopause Day 6 years ago, was those suffering from urogenital atrophy. This is there's a silent epidemic going on of women who are suffering, up to 50% of women suffering from symptoms of urogenital atrophy, but the vast majority of them are not getting treatment. And one of the reasons they're not getting treatment is that their doctors are not actually asking about it. They're not actually thinking that women in this age group could well be experiencing severe symptoms, but it's a sort of taboo subject, and women don't like to talk about it. Not even amongst mothers and daughters, they don't talk about vaginal atrophy. So this was another group who really will benefit from us being more aware of the potential and asking them about it. So the subject, I suppose, really was why treat women at menopause, but it was also asking, well, we must ask women what their problems are to find out if they really do need treatment or will benefit from it. And if, after talking to them and finding they've got symptoms, seeing whether for them that is something that they want and the benefits of treatment would outweigh any of the known risks.